Hello, this is Bishop Jaime Soto, and we are on the Bishop's Corner, and I'm very delighted to have Ann Arend with us, who works for Students for Life, and she's going to talk to us about SB 320. Anna, go ahead.
So SB 320, it's the California Senate bill that would mandate ultimately all universities of California and California state universities to distribute abortion drugs on campus in their healthcare centers. So this is RE46 would ultimately be the drug that would be distributed. It's not to be confused with Plan B or contraceptives. It's an actual abortion drug used all the way from conception through 10 weeks of pregnancy.
Yeah, my concern, and I'm sure the concern of a lot of folks, is that this is not just, well, again, this kind of stuff is not really healthcare. This is not the kind of healthcare that the young women need on a college campus, but that rather it does become more of an indoctrination, promoting a certain ideology, and that is, I think, so that this could be detrimental not only for young women, for their bodies, but also just detrimental in terms of the formation of their minds. And
Right, absolutely. And that is a major concern of ours as well. What these students need is support and care and guidance through their pregnancy. But this only offers that one solution of abortion. And like you mentioned, the mental effects, the side effects of this drug, that girls will be inducing miscarriages ultimately is how this pill works in their dorm rooms alone, experiencing these traumatizing side effects.
right.
It's just awful.
Yeah, it is, and besides that is also that oftentimes that young women are oftentimes victimized on campus. I mean, there is we are right now in a cultural moment when we've become very aware of the sexual harassment that goes on in places of power, but we do know that that is oftentimes can be the environment on college campuses. And rather than trying to address those kinds of issues or change the culture where women can be more respected on campus, that here we are in a certain sense, just rather than addressing that issue of harassment, here we are is actually trying to provide women with access to abortion, which that's again, it's just not the way to deal with some of the problems that we're having on college campuses.
Right. It only furthers the issue. And there's been cases in the past where, young women who are victims of horrible crimes have just been sent to the abortion clinic, and it's covered up. That covers up the evidence of that culture that promotes that. And to bring that to campus is only going to further that. You're absolutely right.
I think another element to this, and again, we are talking about young adults in many cases, but also, these are still the children of families, and that this kind of activity will go on, and oftentimes the families will be their parents, family members will be completely unaware of what's happening to their daughter or sister, and that is that's another dimension of this that unfortunately is puts can wind up scarring young women and leaving them carrying the terrible wound of a bad decision to abort a young life, and that is it's this the whole thinking on this is just very distorted.
Right, right. And to add to that, like you said, these are young girls, 17, 18 years old on campus. They're unfamiliar with the side effects of these pills that could often lead to sepsis, and they're scared to reach out for help if they are feeling those side effects. They don't want to contact their family once they've already taken these pills. So they reach out to the abortion provider again, and the abortion provider often just says, you know what, you're experiencing the normal side effects of this drug. And women have actually died from confusing the side effects of these drugs and not getting proper help with actual symptoms of sepsis and serious health risks. So these young girls aren't going to go to their family for help or to the emergency care providers that they need because they're scared and in that situation.
Well, I really appreciate you coming on on our segment here and helping us to be informed about SB 320. And I want to invite everyone to please go to the website and see how you can get involved with this, and to let your state legislators know that this is not the kind of health care that you want for young women.